A health alert tonight. A local father says he nearly died from flesh-eating bacteria, which he says he caught when he had a vasectomy performed by a Jacksonville urologist. Byron Lewis says he knew something was wrong within a day of having the procedure.
But Lewis says his doctor didn't take his pain seriously and kept sending him home again and again. Channel 4's Jennifer Watt talked with a local infectious disease doctor about what causes flesh-eating bacteria. And Jen joins us now with more of this man's story. Jen.
I'll tell you guys, this is just something that no one ever thinks, obviously, that this is going to happen to them. A man goes in to have a vasectomy and says that he got an infection that nearly killed him. Within 2 weeks of having the procedure, Byron Lewis was fighting for his life, given just a 20% chance of surviving.
My right testicle was getting larger.
Byron Lewis can't sit up. His surgical wounds are still healing, talking about the first time he went to his urologist, complaining about pain from his vasectomy.
There's nothing wrong. Just keep your feet elevated, put ice on you and on the area, and you'll be fine. Well, I did that, and by the next day, it got worse.
He went back to see his doctor.
It was the size of a large egg at that time. And I told him, I said, something is wrong. He prescribed me antibiotics. And that didn't work. At 3 a.m., go to the emergency room. The ambulance had to come get me. I couldn't even walk.
Lewis says the ER saw fluid, but sent him back to his urologist for treatment.
It was the size of a tangerine, my right testicle. And I'm looking at him like, there is something wrong with me.
Even with it that size that you described, he said it was fine?
It was fine. It was fine. Sometimes things happen like this, but it's fine. It'll go down in a couple of days.
At what point did you then realize that this was a terrible infection?
When I went to the emergency room the third time, the lady zoomed in and she said, "Oh my God, you're so full of infection." She said it's spreading all upward to your lower abdominal, it's all in your thigh area, all in your side, that had that flesh-eating bacteria.
Diagnosis of a flesh-eating bacteria.
Lewis's wife was devastated. At the time, she was 8 months pregnant with their second child.
If you look that up, I mean, you just see people's complete bodies just disappear. Everything gets cut off, and you know, that's what I thought was going to happen.
She says her husband's infection could have been caught much earlier.
I had 2 weeks to eat at him. 2 weeks.
And they had to put me on anesthesia and cut me open and put gauze pads and tubes in me. Couldn't sneeze, I would bleed out, and it hurt so bad.
Lewis shows us a picture of his stomach where doctors cut out the bacteria, commonly referred to as flesh-eating. The medical term is necrotizing fasciitis.
There are many germs that can cause necrotizing fasciitis.
Dr. Mobeen Rathor has never treated Byron Lewis, talking in general about how someone can get flesh-eating bacteria. It turns out all of us have some form of bacteria on our body.
Staph and strep is on everybody's skin. It's in your skin, it's on my skin. We're never going to get rid of it.
Most of the time, it doesn't make you sick. But Dr. Rathor says if staph or strep gets into your body and is not treated early enough, it can turn into the flesh-eating bacteria germ.
Can the germ live in a doctor's office on, a scalpel, anything like that, where it could have been transmitted to him during the procedure?
The germ can live anywhere. The germ lives mostly on our bodies.
We have no way of knowing for sure if Byron Lewis caught the bacteria at his doctor's office. So to be fair, we are not naming his urologist. I did, though, call his office and spoke to an office manager over the phone who told me that the exam rooms are kept clean and sanitized. I asked her about Lewis's visits. She couldn't comment, though, citing a federal law that protects a patient's medical records from the public.
Lewis spent 2 months in the hospital fighting for his life. He says he had 16 surgeries and spent hours in a hyperbaric chamber to try to stop the flesh-eating bacteria from spreading. 2 nurses now care for him at his home, where he's confined to this couch as his wounds heal.
First, we need some sticks.
His 5-year-old son reads to him to keep him company.
It broke me down because he was coming to me to give me a hug, and I had to tell him, "You can't touch me. You can't touch me yet. So it's been very difficult.
Have you even been able to hold your son?
I can't hold him. I haven't kissed him yet. I can't even go in my own bedroom.
Lewis says he has to wait until his wounds close completely so as not to risk infecting his sons or his wife, who just hopes one day soon she'll be able to hug the man she married.
I would hope that his body could return to normal and that he could be who he was before, which is a great husband and a great dad. But I don't know. I just hope that he can be here for his child.
Lewis considers himself fortunate that he didn't have any part of his body amputated, which, we've seen in severe cases of flesh-eating bacteria. And he says that he was healthy, feeling just fine when he went in that day to have his vasectomy.
Wow.
That is just heartbreaking.
It
Jen.
is.
Is there anything anyone can do to minimize the risks of this happening to you during surgery?
Communication is so important, and I'm talking in general here because based on what Mr. Lewis has told me, he certainly did everything right. Dr. Rathor, though, recommends a couple of things, that you follow good hygiene, obviously, wash your hands, tell your doctor if you've ever been diagnosed with a germ that is resistant to antibiotics. Now, it never hurts also to ask your doctor how they sanitize their rooms. Flesh-eating bacteria is very rare. We don't want to frighten people here, but bottom line, there is always a risk whenever you have any kind of medical procedure, so you should talk to your doctor and make sure that the benefits outweigh those risks. And as for Byron Lewis, it's just day by day with him. He is expected to recover, obviously, but this has just been an ordeal that he and his family will never regret, and it has been months.
Still getting goosebumps. You said May is when this all started, and you see him still laying on the couch waiting to heal.
It's
So
just
waiting
our
to hold
best
that
to you and your
baby.
family, Byron. Holy cow.
Well, and thinking also, too, for him, he hasn't been able to work. His wife had to take a month off from work. This has been a real financial struggle for them as well.
Thanks, Jen.
Yeah.